Good morning, everybody. Thank you for coming this early on a Sunday morning. It's nice to see so many people. So, I think that teenage anxiety and depression is truly an epidemic of our times. There is rarely a day that goes by when there isn't another scary headline in the newspaper about how many children are self-harming, how many children have eating disorders, etc., etc. So I feel very strongly, my purpose of this morning is to make you all go away feeling that you want to treat teenagers, because I think that they really need our help. So I want to give you confidence that you can help. And in my experience, acupuncture is a really wonderful therapy for anxious and depressed young people. I'm going to talk quite a bit about the reasons that I think so many teenagers become anxious and depressed. And these are very modern causes of disease. There's nothing written in the Chinese classics about social media and exam stress, obviously. But in my clinic, these are the problems that are leading children to come for treatment. I'm going to talk a little bit about some ideas about how to diagnose and treat the most common pathologies. And I want to talk a bit about the practicalities of working with teenagers, because I think what puts some people off is understandably the fear that they're going to be sat in front of a monosyllabic teenager who refuses to say anything other than grunt, and that could be quite difficult. So I want to tell you that it's not that difficult, and actually, contrary to popular opinion, I think teenagers are wonderful, and it's really wonderful to work with them. That's not to say that they don't have their challenges too. So, why do we need to help? A really high percentage of mental health problems in adults began in their teenage years. So actually 50% of mental health problems are established by the age of 14, which I think is a quite astonishing statistic. 75% of mental health problems are established by the age of 24. And one of the reasons that mental health problems arise around adolescence is because that's when the brain is changing particularly rapidly. And when things change rapidly, then there's more chance that something's going to go awry. And as I'm sure you're all aware, the NHS is hugely under-resourced when it comes to treating adolescent mental health problems. There are parts of the country where if an adolescent needs to be admitted as an inpatient, they have to go to a hospital hundreds of miles away from their families, for example. It's very often only young people who are at the really extreme end of the spectrum that get help quickly. And there are many that aren't in that category that really need help and are on waiting lists for months, sometimes years, and sometimes they can't even get on the waiting list. So I feel that we have an important part to play in going some way towards filling this gap. And as I'm sure you all know, what better way to treat the spirit than with acupuncture? It's a far more effective way, in my opinion, of treating the spirit than any medication or any other form of medicine that I'm aware of. So we bandy these words about anxiety and depression, and often teenagers will say to me, I've been told I've got depression or I've got anxiety. But actually we're in the fortunate position of practicing a form of medicine where we can make really bespoke diagnoses and then tailor our treatment in a similar manner. So every young person that comes to you who is anxious or depressed is anxious and or depressed in a very different way to each other. And just as the Shen make us unique, they're what make us an individual, when the Shen become imbalanced, they become imbalanced in a very individual way. So we have to ask ourselves, in exactly what way is this young person in front of us not thriving? Even if we've seen 100 other young people who are anxious or depressed, we will never have seen exactly the manifestation of the individual that we have in front of us at any one time. So how do we go about understanding the way that each person is suffering? I love this quote by Claude La, that grasping the Shen is like hunting. You must follow its hiding and escaping. So we have to create space in our treatment room for the Shen to reveal itself, so that we can begin to get a sense of its nature. And we also need to create space within ourselves, and we need to have an empty, still heart in order to be able to contact the Shen of the young person that's with us. And one of the most important things, I think, that differentiates our treatment of teenagers from most of our adult patients is that we can't necessarily rely on them talking to us at length about what's going on inside them. If you've ever tried to ask a 15-year-old boy what's going on inside him, you may not have got very far. Teenagers are famous for their lack of self-awareness. They often don't really know much more other than the fact that they're not feeling good. And to try and probe them at length will, I think, literally could send them running out of your treatment room. And actually, I think it's one of the things that stops more teenagers coming for acupuncture treatment, that they're worried that they're going to have to talk at length and that someone's going to probe them about their internal world. But as this quote from the Su Wen so aptly says, the spirit cannot be expressed through the mouth, only the heart can express all that can be looked upon. So it doesn't matter if the teenager can't tell us much. And some of them can and will choose to, but many won't, and that's okay. And I think as the practitioner, we need to be led by them. So we need to really hone our skills of observation if we're not going to be able to get much verbally. So we need to look at their eyes, their body. Are they tense? Are they slumped? Do we sense an agitation in them? Can they make eye contact? We need to take their pulses, obviously. And it's through these observations and palpation methods that we're going to get most of our information. So, what is our role as acupuncturists? Obviously, we need to try and create balance and harmony in the chi of the young person, and then their emotions will inevitably flow more smoothly. But we need to help the child navigate the wide range of emotions that is, after all, part of being a rounded human being. And I've heard teenagers say things like, I'm really worried because I get angry. Or, I'm really anxious about exams and I don't feel that I should be. It's not realistic for a teenager to only ever be absolutely fine. And sometimes getting that message across is an important part of the treatment. And we need to create a really non-judgmental space where if the young person wants to, they can be open. So some teenagers go from being harassed and nagged at home to being harassed and nagged at school, and they, after some time of this nagging and harassment, begin to forget themselves that actually they're an okay human being. So a really simple thing that we can do is to treat them with the biggest amount of compassion that we can summon, and not make any judgments about what they're doing in their life or about what they're not doing that they should be doing or that everyone's telling them they should be doing, and just accept them for who they are, how they present to us. And I think rather than having the idea that we need to fix the teenager, I prefer to think of it as setting them off on the right path. So if any of you remember playing poo sticks as a child, if you throw your stick off the bridge and it goes into the water, and occasionally it gets diverted off to the side and it gets a bit stuck in the reeds at the side, and all it needs is a bit of a nudge to get in the flow of water again. And that's how I see our treatment of young people, of anyone actually, just to kind of give them that nudge that they need with our needles to get back into the flow. And I think it can actually hamper what we do if we find ourselves thinking, right, I have to fix everything here. Whereas if we just see ourselves as facilitators, I think things generally go better. So equally important is what we should not be doing. And we shouldn't be trying to create the kind of adolescent that the parent wants their child to be. So fairly recently, I had an email from a parent asking me if they could book their 14-year-old daughter in for treatment. And the mother said in the email that she was having behavioural problems. So I booked her in and she came for treatment. And the mother told me very early on that she was really worried and things were really difficult. And I said, well, what's the nature of the difficulty? And she said, well, my daughter slams the door and goes up to her bedroom. And I said, and what else? And she said, well, I mean, it's awful. And I said, well, how often does she do this? And she said, oh, sometimes once a week. So I tried to find a way of saying to the mother that I thought that her daughter was actually doing a really good job of being a healthy teenager. And I obviously, checked out everything else, and actually that was the extent of her behavioural problems. So in that situation, actually just being able to reassure the mother that this was fine, this was part of the course, was enough. And if we find ourselves working with young people who are really severely mentally ill, then it's important to make sure, when necessary, that they're seeing other healthcare professionals if we or they feel that that's what needs to happen. And we may only be a small part of the young person's recovery, but even being just a small part is still really valuable and worth doing. So, what do we have to offer that talking therapies don't? Well, as I've already said, many teenagers are reluctant to talk, or they literally don't know what to say. And one of the wonders of acupuncture is that we can bring about a change in the young person's chi without this need to talk at length. So, for example, I'm treating another girl who's also 14 actually, and she suffers from quite severe anxiety. And she'd been to see a counsellor before she came to me, and she said she didn't feel it really changed anything. She knows why she's anxious, because she has very severe celiac disease. So if she accidentally even, comes into contact with a crumb of gluten, she can be ill for quite a long time, and it's hampering her school life, etc. So from my point of view, she had an excess of heat in the body, and she had heart, blood and yin shu. So clearing the heat and nourishing the heart, blood and yin is helping her to feel less anxious. And I don't believe that any amount of counselling would do that, as it were. So similarly, if a teenager is responding to everything in their life with anger and rage, they might talk about that until the cows come home, but smoothing their liver chi or subduing their liver yang or doing whatever is appropriate in that situation will mean that they respond to life differently. So before I talk about the individual etiologies, I just want to make a few general points about etiology. And of course the classics talk about the superior doctor as one who understands both the condition and its cause. So every young person responds differently to anything that could potentially be an etiology. So we shouldn't jump to any conclusions about what is causing the teenager to be ill. Some teenagers go to very pushy, high-achieving academic schools and actually thrive in that environment. For another young person, that would be enough to cause them to feel very anxious. So one person's cure is another person's poison. So don't jump to any conclusions about what's making them ill. And causes of disease rarely occur in isolation. So normally you see a context that's kind of arisen in the young person's life that's led them to be where they are today. And I think a really important point is that causes of disease are amplified in children and teenagers. And I'm going to talk about this more in a minute. But during the years of adolescence, the chi becomes very open. And it's as if a caterpillar who's had a chrysalis around it, the chrysalis starts to break away, and that leaves the teenager feeling more vulnerable and less able to withstand some of the pressures of life than we as adults can. And having an understanding of the etiology obviously informs the lifestyle advice that we give. And this is important because if we become another person who is saying to the teenager, you have got to start eating vegetables, going to bed on time, coming off your screen, doing more exercise, studying more, then we're just doing what their parents are probably doing and their teachers are probably doing, and they won't want to come and see us, and they're less likely to do anything, to make any of those changes. So if we really try and hone down the biggest etiology, and once we have rapport with the teenager, just focus on bringing about a change in that one area, there's a much higher chance that they will actually make that change. So, moving on to etiology. So, I think very often the problems start a long time before we see the teenager. So I love this quote from Sun Si Miao, the idea of plugging your children's ears when there's thunder in the sky and protecting them. It's basically saying that the shen of a baby is like a delicate seed, and we wouldn't plant a seed straight out on the allotment in the middle of winter. We'd put it in a little greenhouse and we'd nurture it, and then gradually, as it grows and gets a bit stronger, we would expose it to more and more of the environment. And the same goes with children. So if a child has had a trauma either in utero or in the early years of their life, it may have bubbled along in the background, and then with the change of hormones at the teenage years, it brings this trauma up to the surface and magnifies it, and it may then cause depression or anxiety in the teenage years. And trauma is not necessarily something that we would all classify as trauma. A trauma for a child can be a really small thing that just happened to resonate with the child in a particular way that made them feel traumatized. So, for example, a child may watch a film or read a book that other children of that age are absolutely fine with, but there's something about the look of a character in the film or the description of a character in the book that lodges itself in their psyche and affects their shen, sometimes for many, many years to come. I'm treating a child of 10 at the moment who has 3 older brothers, and they were, for the first time, babysitting. The oldest brother was babysitting the siblings, and he chose to put on some kind of, I don't think it was a horror film, but it wasn't appropriate for this girl who at the time was 7, and she's now 10, and ever since then she has not been able to sleep on her own. You know, that's 3 years from one film that's agitated her shen in some way. So you can't expect the child or the parent to say, my child had a trauma, as it were. It may be something so subtle that no one really knew what was going on at the time, but it's still leaving its effects. And another big etiology in teenagers and children is that they imbibe the emotions of other family members. So I'm sure you've all had adult patients who say to you something like, well, I know I'm a worrier, but I think it's because my mum was always a worrier. And children and teenagers are like sponges. They absorb everything in their environment. So if they are surrounded by an adult who is angry, who is anxious, who is depressed, then they almost swallow this. And as their chi is setting, it becomes a part of their chi. It's like if you walk on cement that hasn't yet set and you leave a footprint, and then it's there forever. So a few years ago I was treating a boy of 12 for anxiety, and he was incredibly anxious and jumpy. And for the first couple of treatments his mother brought him, and I couldn't really see anything in his life that had obviously led to him being so anxious. So I sort of put it down to constitution. And then for his third treatment, his father brought him for the treatment. And his father was the most jumpy, agitated water CF you can imagine. I felt quite kind of agitated just having him in the room. And I kind of went, there's my etiology with this boy. He's literally absorbed this agitation from his father, and it's kind of become his own. So obviously he was going to carry on, I hope, living with his father. I couldn't do anything about that, but treatment helped him to withstand that better. And I think that's another important point, that we can't always take away the etiology, but we can help the young person to cope with it better. So in that boy's case, he had a fire constitution. He was a fire CF, and strengthening his fire made him more robust, being around this degree of agitation.
Question.
Yes.
Could you then treat his father? I mean, then be out there.
It does beg that question, doesn't it?
Yeah.
Yeah. I think that if that feels like an okay thing to suggest, then absolutely, yeah. Sometimes I find what happens is you go around the family. So when you treat a child who's ill and they get better, then it's as if the imbalance is kind of shifted to another member of the family. And then it's often another sibling, and then they get ill in some way, and then you treat them, and then eventually often you get round to the parents. But yeah, often that's a good thing to do, definitely.
Rebecca, so in that case, how did you explain what was up with the child to the family? Did you just not do that?
I didn't in that case, no. And I think that it's important to just remind ourselves that 99.9% of parents are doing their very best, as it were. And we're just talking about imbalances of chi. It's not about judgment, it's just the way it is. So in that situation, I didn't feel it would help, actually. So, moving on. So these etiologies, again, can start from earlier in life, but continue into the teenage years. So it's easy to sort of idealise past times, isn't it, and think that everything's really difficult now for teenagers, and it never was. But actually, I'm sure it wasn't like that. But I think that the challenges that teenagers face now are unique. They're a different set of challenges to previous generations. And one of the challenges that is pervasive for so many teenagers is an enormous amount of pressure. So this pressure may be in the form of over clockworked lifestyles. So going from school to activity to activity to activity, at the weekend doing more activities, and never really stopping. It may be a pressure to achieve academically. It may be a pressure to achieve musically or in whatever sphere. And from an early age, the child often just feels, well, they've never known anything different, but they've grown up with this kind of having to sort of steel themselves and brace themselves to get through their day and to get through what's expected of them. And that has a big impact on their chi. And it affects different young people in a myriad different ways, but I think it can constrain chi because there's no time for breathing out and letting the chi flow. I think it's very depleting of yin, of blood, of chi, of yang, of possibly every vital substance. And in the teenage years, then the added pressures come in of social media, which I'll talk a bit more about. I'll talk about that in a minute, actually. And then growing up under a microscope. So some children have the sense that everything that they do is analysed, examined, assessed, judged. They're watched all the time. You know, are their activities, are they, you know, the most beneficial thing for them to be doing? And this term helicopter parent comes to mind. But when a child is watched, then the Shen, which should be emanating outwards, starts to turn itself inwards. And, you know, children need space. They need to be going out making dens. They need places to hide. They need to have secrets. And very often, partly because we have fewer children than we used to, you know, you can't do that if you have 7 or 8 children. But if you have 1 or 2 children, the pressure on them tends to be much greater. And I think that this is a big cause of anxiety and depression for some children. And if they have been, if they haven't been allowed to exert their will, if they haven't been able to test that, to test and to develop a self-will, then their je doesn't get any training, as it were. And then suddenly in the teenage years, they actually have to be a bit more independent because they have to get themselves to school on their own or whatever. And they have no knowing that they can do that. They don't have that inner knowing that they're all right, they can cope in difficult situations. They don't have the resilience because they haven't been allowed to sort of gradually test that out as they've been growing up. This cartoon from Private Eye made me laugh. And it's kind of true, isn't it? You know, are you struggling to read it?
Yes.
Back there. So this father is saying to his son, wear a helmet, keep safe, play nice, don't leave my side, don't go out alone, always beware. And then as a teenager, his father's saying, bloody snowflake, you know, you can't cope in the world, why are you still living at home? And I think that says a lot. Oops. So, moving on to the dreaded topic of social media. So, when a child is constantly on their phone is pinging away, they're on a million different chat groups and everything else, then their Shen never has a chance to settle and be still. So it very often reaches a state of permanent agitation. So a typical pattern may be that the child is stimulated at school and they come home, and the moment they walk in the door, their phone starts pinging, and then they're kind of constantly, who's this? What are they saying? Am I being left out? Am I being included? Do I look good in what I've posted? Oh, this person is doing far more exciting things than I am. I haven't been invited to this party, etc., etc., etc. So it just means that at a time when their chi is open, when they're growing and developing incredibly rapidly, they are constantly agitated by their use of social media, particularly just before bedtime, when ideally the Shen will start to return to its residence and settle down, ready for sleep. But that won't happen if the children have phones and screens and everything else in their room, and they're on it until they then try and go to sleep and find out that they can't. And I think it also has a more long-term pernicious effect of children just feeling that everyone else's life that they post on Instagram and Facebook is perfect, because people don't post photos of them looking bored. They don't post photos of them with their face full of acne. They don't do posts saying, I'm feeling really down, or I'm finding life difficult. It seems that what they see is people smiling, happy, having a wonderful time and looking perfect, and they begin to feel that they are somehow lacking themselves, because they're getting an unrealistic picture, and that very much feeds into the depression and anxiety. And actually, interestingly, there was quite a big study done at the University of Michigan, and it found that replacing face-to-face contact with friends and family by using social media, texting, emails, could double the risk of depression. And it's thought that the parasympathetic nervous system is stimulated through the sound of voice and the small kind of messages that you get from looking at someone's face. So if you're not relating face to face, then your nervous system doesn't have a chance to kind of rest and digest, as it were. It stays on this kind of hyper alert level. And not wanting to be too sort of gender stereotypical, but excessive social media tends to be more of a female problem, and computer games tends to be more of a male problem, although obviously it's not black and white. So playing adrenalized computer games fires up the kidneys. It taps into the young person's adrenaline, and they have to adrenalize themselves to kind of keep up with it. And that's why for some young people, when they come off their PlayStation or Xbox, they're really grumpy and irritable, because their kidneys are still kind of in overdrive from the adrenaline of the game, and it takes a while for things to settle down. Obviously, playing computer games involves a lot of being still and stationary, so it tends to constrain and stagnate chi as well.
ask what about young children coming home and just having the television on? Is that as stimulating to them, or is that still really bad for them?
I don't think it has the same effect actually. I think it's partly because it's further away generally, it's not kind of right up here, and it's less interactive.
Yeah.
So I don't
So
think
that can be good downtime for them.
Yeah, I think it tends not to have the same agitating effect.
Can I ask about other computer games like Minecraft and things that aren't quite as stressful?
Yeah, I think that's different. I think it very much depends on the computer game.
That's
So
interesting.
I think that things like Minecraft are about as good as it gets. Fortnite is the really bad one. Fortnite is causing more problems in families than I hear parents ruining the day that they ever allowed their child to play Fortnite. Yeah. It's incredibly adrenalizing, apparently. But it's very hard because that's often the young person's way of, they play with other people who are not in the same house. They somehow link with each other. So it's important to them. So it's all about balance, isn't it? Lack of sleep. So as many of you are probably aware, the circadian rhythms of teenagers change. So melatonin, which helps us to fall asleep, is released in the teenage brain about 2 hours later than it is in the child or the adult brain. So when we're telling our teenagers to go to sleep at 8:30 because they need to get up early in the morning and they're lying in bed unable to sleep, it may be because they're on social media, but it may be literally because they can't go to sleep at that time. And then, of course, they have to get up early for school. So ideally we would change society and we'd make secondary schools start later. But we can't do that, and as a consequence, many teenagers are chronically sleep deprived. And when we sleep, our chi is replenished, the blood goes back to the liver and is nourished, and our yin becomes strong and solid. So a lack of sleep can be a factor in anxiety and depression for those reasons. Now I should stop here because we're meant to be having a break now. We've got a couple more etiologies, but I will pause there. Are there any questions before the break? Okay, so I think we restart at 10.